My name's Larissa Leontos, and I'm the Hematopathology Residency Director, and I'm also a staff hematopathologist at Sunnybrook Health Sciences Center. Hematopathology is studying blood and bone marrow and hematopoietic tissues. A lot of what we do is diagnosis of different blood cell cancers, but it's not the only thing we do. We also look at coagulation testing, so that's clotting of the blood, and we also do transfusion medicine. So there's a lot of different aspects to hematopathology, but the major thing that I do here at Sunnybrook is look at blood and bone marrow and make diagnoses.
So I was actually picking between this and internal medicine. But I think people who are interested in hematopathology sometimes go the route of DMP or diagnostic and molecular pathology. For me, I chose the HemPath program in particular because it covers areas that I was more interested in.
The University of Toronto training program is excellent because we have so many faculty that are just really keen and enthusiastic about teaching. You'd have great teachers here at U of T, as well as really diverse environments. So we have several hospitals that are primary sites of teaching. So the Toronto General Hospital, Sunnybrook, Sick Kids, St. Mike's. And then we also have some smaller locations like Michael Garron Hospital, where you have more of a community feel of what hematopathology would be like in that setting. And really a plethora of cases. All the complex and interesting cases are coming to us.
I think from a HemPath perspective, Toronto is really, really attractive because it's such a large city, meaning in a specialty where you learn from seeing cases. You get not only high volume of cases, but also really diverse and rare cases that you wouldn't see anywhere else. We have Sick Kids in Toronto, which I think is a huge benefit. It's the biggest pediatric hospital in the country, and you get all the rare and wonderful cases that come through that hospital that you wouldn't necessarily see elsewhere, and I think that's been really helpful in terms of learning. In Toronto, you really get access to the smartest and most amazing people in terms of mentors.
The HemPath residency program is actually a little bit different than some of the other Royal College programs because it's a primary program right out of medical school. It's 4 years, and we sort of jump right into hematology. The clinical rotations that you do in your first year are really focused in heme. So we do adult hematology rotations, pediatric hematology rotations. And then there's 1 month rotations to kind of introduce you to different aspects of the field. So for instance, flow cytometry, transfusion medicine, coag. The residents are going to get a 1 month of each type of hematopathology subspecialty to get an introduction to all these areas. And then the next 2 years are really what we call core. And so during the core years, you're really accumulating the number of cases you're seeing, and you're doing these entrustable professional activities, so EPAs, where you're going to perform skills or look at particular cases and have your staff sort of say you're ready to move on to the more advanced cases. And then the final year of the residency program is a transition to practice, focusing a little bit more on the lab management aspect of things, focusing on presenting cases at multidisciplinary rounds, making sure that they feel ready when they're on call.
HemPath, if you're considering it, is a specialty that really does a great job of blending clinical and laboratory medicine, and you really get a taste of everything and incorporating diagnostics into one specialty.
Without hematopathology, we wouldn't have diagnoses for different types of leukemias and lymphomas. All the patients that we have in the hospital that have leukemia and lymphoma have had their samples looked at by a hematopathologist. I just really enjoy being the first person to make a diagnosis. It's kind of a satisfying moment to be able to solve a puzzle for the clinicians and for the patient.